right, well, welcome everybody. This is definitely an opportunity for us to acknowledge the role that the Rural Health Clinic has had in this community for 20 years now. And really you have to look back to what a vision is. And we always speak about vision within the organization as a way to show us where we're headed. And the fact that Dr. Brown and Tracy Aspel and so many of the folks, both still here at the Rural Health Clinic and still within the community, had 20 years ago, really goes without saying as far as being monumental. Bringing rural healthcare access to the community the way that this team did is nothing short of a miracle. It continues to take us into the future and show us what it means to be able to provide the care and the access for our community that they had that vision for 20 years ago. And I feel really proud to be able to be part of this, but also to be able to stand here and acknowledge all of the team members of the Rural Health Clinic and throughout the district that continue to make this work day in and day out. And without Dr. Brown, we couldn't do that. And so it's with great pride that I just say thank you to that team and thank you to Dr. Brown. And I'll turn it over to Dr. Brown now.
Thanks, Kelly. So I whipped this up in yesterday morning. So I'll read my notes, but you know how I go off script anyway. 20 years on this campus. You harken back to 2001 and, you got Clinton as president. You've got gas that was less than $1.50 a gallon. You've got, top 40 billboards by, Alicia Keys and, I don't think Lady Gaga was even on the scene yet.
Lady Marmalade.
Lady Marmalade, thank you. See? Christina Aguilera fan right over there. Yeah. I dated myself this morning. I asked somebody about Cliff Notes and I got this kind of blank look on my face. Does anybody know what Cliff Notes are anymore? Yeah. But a lot of fond memories come to mind, on this campus here. A lot of things happened within the institution and the clinic as well. Birthday potlucks that we used to have. Halloween costume contests at the district, which we won pretty much routinely. We had Christmas parties, with a lot of the standard stuff that we had come to love. Mara's fresh bread, Tracy Aspel's twice baked potatoes. I would always bring tri-tip. Tracy Drew's chocolate torte. Those were kind of staples for each of our Christmas parties. And putting our handprints on the concrete right around the corner here by our stairs is a couple of handprints from some of the people that started this building as our second edition, and we stuck our hands in the concrete when no one was looking. But it's not just personal memories that come kind of being in this area too. It's the memories of kind of the before times, and I don't mean the pre-pandemic times. I remember the times before we had good quality primary care in the district. And if you didn't have insurance or you didn't have Medicare, Medi-Cal, if you didn't have Medi-Cal or you didn't have insurance, you were kind of screwed. There was really no footprint for primary care, preventative medicine. There wasn't the episodic care other than the emergency room. I mean, imagine the only place you could take your kid as a single working mom for an ear infection was the emergency room, and you get like a $300 bill. So the system was broken, and the community really struggled with kind of the affordable healthcare concept. So enter now kind of a partnership between the district, the county, my old office, Family Health Center. We had a grant that was about 70 grand, and we purchased this double wide modular right here, stuck it on the west end of campus when there was nothing else other here than the hospice building. And the partnership really brought us kind of this capital, double wide here. And the vision was really very simple, but very compelling. It was ready access to affordable health care, no matter who you are. Pretty simple, right? Pretty profound too. But to get there, we really needed some strong leadership and some innovative strategies. So I hired the most capable person I could find, which was Tracy Aspel. She was working in the emergency room at that point, and the emergency room called me a lot of dirty names by stealing her from there. You know, that really was kind of that crucible of change. And we've always been that crucible of change and innovation. We had a lot of firsts on this campus. The first kind of non-emergency room primary care that was open on Saturdays. We had the first APP that was employed by the district. My first nurse practitioner, anybody remember? Norma Kreider. So Norma and I ended up staffing this one as the first APP of the district. Now we've got APPs everywhere in the district, and that was our first contribution. Our first outpatient electronic health record in the district was Centricity back in the day, 2007. So that was really fun too. And of course, a lot of other firsts, same-day service line and urgent care kind of thought process as well. That was us. We did that, you know, and we're real proud of those things. Thinking outside the box too was part of our innovative strategies. So people remember before we had hospitalists, the docs that took care of you if you didn't have a primary care provider in town or insurance was the primary care providers are working in these buildings. So we as family docs ended up rotating through the hospital, taking care of those patients for the district. Drive-in vaccination clinic, right? How many of us remember the drive-in flu shots in the hospice building here? John Ungersma coming in on his horse, right? Getting a flu shot on his horse. I got a picture of that. Growing our own staffing, so really giving back and paying it forward for education. Our student program, producing a lot of students that went through our program and are now back in healthcare and into the district. Students, pre-med students, residents, new docs, you know, anybody that wanted to learn medicine, we had our doors open so we could build our own concepts, our own process as we went forward. Medical assisted treatment for substance abuse. Again, those innovative types of things that help to promote the community's health. Embedded behavioral health, the care shuttle to get people to their appointments, home visits, care coordination, population health, and then of course COVID testing for the last 500 plus days in the front of the old hospice building to try to get our community safer and identify patients with COVID, get them the appropriate treatments. All that stuff, that is us, right? We continue doing those kind of innovative types of strategies to help the healthcare. We're constantly reinventing ourselves. We're pushing the envelope and we're setting the bar really high. But we never lose sight of the vision, right? Ready access, primary healthcare, no matter who you are. And certainly we've had our challenges, right? I mean, yesterday was like Mount Vesuvius here in the parking lot. I'll never forget that, right? 20th anniversary, and we've got like a little mountain. And then how many times do we kind of recycle the 5-year plan to get a new building, right? I would tell the staff every 5 years, don't worry, we're going to get a new building. We won't be in the modular forever. We won't be on that modular forever. And they're like, yeah, we'll see it when it happens, Brown. How many times did we displace our primary care providers out of each one of these buildings to make room for patients? Multiple times. We've played musical chairs with all the providers, and when I talk to the providers, they're like, okay, where are we going to move next? The roof? Because we keep using all the available space that we have. But again, never losing sight of that vision. And visions persist, you know, but people don't. People move on. They have families. They move to different places. They retire because they get old. They die. So part of a vision really, and the ultimate test of a vision is really about pertinence and permanence. How pertinent you are to the community, what you do for these folks, and a sense of permanence, not for somebody that's been here since the beginning that eventually will be gone. But to be able to have enough like-minded people who share that vision or are willing to carry out the hard work that it takes to get it done. And also the folks that teach the next generation of that staff, that instill that kind of aspirational hope as we move forward. I'm going to read a little segment from a letter that my wife wrote me in 2015, now 6 years ago, about kind of the RHC. And actually the context is at that time, it was the only time that I stepped down as director for about 6 months. And so this letter was kind of a congratulations, a wake-up call. So, dearest man, congratulations and thank you. You would have improved plenty of lives as just a doctor, and you still will. But you've also worked a miraculous change in Bishop's collective cultural and mental landscape. Before you came along, it was a radical idea to create a place where outpatient health care could shelter, much less thrive. People regarded access to good health care as a product of luck, serendipity, and years of searching. Barely anyone had heard of a nurse practitioner. The only person I knew who thought physician's assistants might have a place in Bishop's medical landscape was a nurse practitioner who was married to one. And now people take the rural health clinic, NPs, PAs for granted. Even though the RHC didn't exist when most of them came to Bishop or were born here. It was an act of great skill, intelligence, and persistence to move the RHC in the community's collective mind from ridiculous to possible, to probable, to likely, to impossible to live without. So to repeat, congratulations. The effects of your good deeds will ripple on long after we've ceased to exist. Think about that and savor it. So, on our 20th anniversary here at the clinic this November, celebrate our vision for the community. Celebrate the successes that we have achieved and the challenges that we've overcome. And celebrate the successful future that we all have a part in creating. And savor it. Just savor it. Thanks.